My phone's not on. Okay, so hello and welcome to our seminar here in ILAS at NUI Galway, and a big welcome to everybody who has joined us online. My name is Edel Murphy. I'm the Programme Manager, the National Programme Manager for the PPI Ignite Network, and I'm delighted to have been asked by the team here in Galway to chair this session this afternoon. So this is the first of 6 events happening in the University of Galway as part of the National PPI Festival. There's over 50 events happening all over the country, and I think what's particularly special about this is we were keen that events would develop organically. Maybe suggestions come from people who aren't actually centrally part of the network offices, and I'm delighted to say that today's speaker, Roddy, contacted us and volunteered to give a presentation today. So that was excellent from the aspirations of the National PPI Festival. So today we're recording Anne's presentation, and we're going to have a 25-minute presentation roughly from Anne, and then we have a response from Carmel Geoghegan, who is a PPI contributor, and also from Cormac Forkan, who is a researcher at the Unesco Child and Family Centre here in ILAS in NUI Galway. So Anne has this year completed a Master's in Ageing and Public Policy here in University of Galway, and her thesis focused on PPI, which was wonderful. And I'm going to leave Anne to both introduce yourself, Anne, and to tell us about the research. So over to Anne now.
Thank you, Doug. Okay, hi everyone. Thank you very much for joining us on a lovely wet and windy Galway day, as we come to expect. So as Adele said, my name is Roddy. I've just completed the Master's here in Ageing and Public Policy, and I'm probably not your typical student in that I'm definitely coming to this as kind of a second career. So I have worked, my background is in industry, in IT, financial services for many years, but I am very interested in moving into more health and social care aspects, and just about to kind of pivot into that. So this Master's was really kind of a bridge for me to do that. So that was where I kind of came from. So let me see if this clicker works. That way. I'm like pointing the wrong way. Hang on. It's always the first. There we go. Okay. Very good. So yeah, as Adele said, the research I conducted was part of the thesis for my Master's, and I had an interest in the whole area of PPI, and talk a little bit about my motivation. One of the modules we were given an introductory lesson or lecture on PPI by lovely Martha over there, and I just thought it just captured me. It just really spoke to me, and I just thought this is a really interesting area. So when it came to doing the thesis, I thought, okay, I'll actually do a PPI project. And I think as anyone who works in PPI will realize, it takes more time than you think. So after a little bit of consultation with my supervisor, Eamon O'Shea, we kind of realized, you know what, this is going to be a little bit too condensed. So I pivoted into looking at it more from a researcher's perspective, and just thought that this is something that there's not an awful lot of publications in this area. So I thought this might be something interesting. So in terms of my kind of initial impressions when I started doing literature reviews and everything else, definitely the whole area of PPI, the terminology, the definitions, the whole area of kind of collaborative research, there's a lot to it, and there's a lot of I would say kind of terminology instability, so definitions kind of vary. So I think if you look at the PPI definitions we use here in Ireland and in the UK, it goes like engagement, participation, involvement, whereas in the US and Canada, engagement is like the highest level of kind of participatory research. So it can get very confusing. So for that reason, I try to focus my kind of background reading and everything else much more on understanding the motivations, the values, the standards, and so on around PPI, because that really kind of grounded me in, okay, what are researchers actually doing? There's a lot of arguments out there around using PPI, and they're very varied and so on. And I would say, certainly from the reading I've done, PPI in Ireland is still probably within the first kind of decade. I think 2014 was the initial kind of when the HRB started kind of funding initially. So it's still relatively early days from a research point of view, but there's no doubt in my mind that PPI is here to stay. It's very much seen as fundamental to health and social care research and the reform in general. And just before this talk, myself and Del were talking about some of the work that the HSE are doing around the patient voice. So I think that's a good thing. I think this is definitely on point and an interesting area. Okay, so in terms of, move on. Perfect, okay. So when I started doing the literature review, most of the papers I was focused in on were around the researcher's experience. There's lots and lots of papers on PPI studies and so on, but trying to get at the researcher's experience specifically was a little bit harder. The first three papers that I've listed here in terms of Brett, Boas and Boylan, they're all pretty much based on UK studies. And the way I would kind of summarize all of them is really it's kind of a mixed bag, right? The researcher's experience, there's some great positives in terms of benefits like fresh insights into issues and building of those relationships, you know, feeling that it is better research, better outcomes and so on, but also plenty of challenges identified, right? So I kind of highlighted a few things there about, you know, it talked about those who are positive about some involvement and those who are pragmatically accommodating PPI. And I wrote down one quote here, which I thought was kind of interesting. Now it is from this Boas 2014 paper, which is, you know, almost 10 years ago, but at that time, the research talked about the conclusion in that particular paper says, science remains the preserve of scientists with patients and public invited to tinker at the edges, which I thought was kind of interesting. The other paper there in terms of Boylan et al., that was a bit bigger, 36 health researchers, and it's a bit more recent as well. And again, lots of great data in there. The tagline, again, I'm big into taglines. About 60% I wanted to do it. I think that summarized that paper really well, all right? Because there's definitely rewards and enthusiasm and all of that, but there was also, you know, a lot of honesty about the challenges. One other thing I took away from that particular paper, which I thought was interesting, was around, in a lot of cases, the researchers who are doing the PPI are more junior researchers. I don't know if I'm using the right terminology there, entry level, is that the right term? More entry level researchers. And a lot is spoken about in the PPI literature about power dynamics between PPI contributors and, you know, the researchers. But there was also kind of nuances in that particular one around the power dynamics within research kind of hierarchies and so on. So the researchers who are on the kind of cold face of PPI, they become the advocates for the contributors. They become the people who are kind of the voice of the contributors in more, I'll say, academic-led discussions. And that can have its pros and cons like everything else. So I thought that was kind of interesting as well. Moving then to Australia and the Mackenzie paper there. That one also, you know, a mixture of barriers and benefits. That particular research, and I think a lot of people who work in PPI will identify with this, they were trying to work with Aboriginal people, so trying to find the quote unquote right people was really difficult. And it took them a long time to kind of build up those kind of relationships and so on. But they saw that the relevance of the research and getting that wider community and support and beneficial long-term relationships were there as they kind of progressed the study. The only one that I was able to find from a paper at a kind of more general European level was this Dutch study, which talked about the added value of patient involvement, but there was still that theme of reluctance because of the uncertainty around patient researcher role patterns. And finally then, McCarthy et al. This was one, the only one I could find from an Ireland point of view. So this is 2019, fairly recent, and it was done in UCD, and was done with preclinical researchers who are not typically patient focused or patient, what's the word? Meeting patients, right? Is that the word? And they did a really nice job in that paper, I think, of kind of breaking down the many kind of I suppose, challenges with PPI. They broke them down into things what they call barriers, which were kind of institutional issues, things like, you know, getting ethics, funding, that kind of stuff. The concerns, which were things that the impact on the research. So, okay, doing PPI is going to take more time, and what will that mean for my research? And then the worries, and these were like personal worries of the researchers themselves. So they may feel, well, I'm not the person to stand up in front of a room and communicate, or I have social anxiety, or whatever it might be. So a lot of the themes in that paper, I certainly saw some of those themes coming through when I went on to do my own research. Okay, so that's kind of the literature review. So then if I go in and talk a little bit then about the study itself. So my methodology, I conducted 11 semi-structured interviews. They were done over Zoom in around the end of May, June, July timeframe earlier this year. So it's pretty recent. Varied levels of experience. So some researchers here in Galway, in UL, and Trinity, and a couple of people who had done research in academic settings, but now had moved on to working in charities. So I got a good mix of people overall, which I was really pleased about. And the way I structured it was really, I shared with people in advance some questions just to kind of get the brain flowing a little bit on the thought processes and so on. But the questions were very much focused on, their knowledge of PPI, why were they using it, how did you go about finding contributors, what were the benefits, what were the challenges. And then at the end of each interview, I asked each researcher, how would you rate your PPI experience? And I asked them to rate it on a scale of 1 to 5. And this is getting very quantitative here, but I really wanted to try and get a sense at the end of all this, because, in a conversation, you talk about all sorts of things, but I really wanted to kind of walk away with a sense from each person around how was your experience? And so from poor through to excellent, that was the rating scale. So in terms of strengths and limitations, I would say this is probably one of the first studies in terms of the researcher's experience. So I think it's a kind of a useful pulse check, if nothing else. It is a small sample size, certainly not representative of all views, couldn't be, but I think it's it gives some indication of some other potential future areas for research. And again, I would say I was talking about PPI in general, and going back to the point I made earlier about kind of terminology instability, I didn't get into the specifics of the definition of what you were doing or anything like that. So it was certainly open to interpretation around the levels and the activities that researchers were engaged in. Okay, so in terms of the study findings themselves, so based on that rating scale, and again, small sample, I'll grant you, but the average rating was really positive, okay, coming in at 4.4 out of a scale of 5. And there's some quotes there. I don't know if you can move that, John, can you?
Yes.
So that people can see just for people in the room. Perfect, thank you. Yeah, so you can read the quotes here. So, some really nice positive quotes there in terms of it being a great experience, and seeing firsthand the difference the PPI can make to a project, all the lovely people, that people meet as part of that. So definitely the relationship building is a big part of it. In the course of the discussion, I asked everybody a little bit about their training in PPI, how they had been trained up. And depending on when people started in doing PPI, some of them described it as kind of experiential training. So they were learning as doing it as they went along. But a lot of people, particularly those who were kind of current PhD or recent PhD graduates, they talked about the PPI Ignite network training and the resources there being really beneficial for them. As I said, the levels of experience was varied, but even those who are not using PPI, they were very still positively inclined towards it. They saw the value of it, they saw the worth of it. And there were a couple of folks who had done PPI maybe in the past, but due to the nature of the current project, maybe it doesn't need it from a funding point of view, or the nature of the project or whatever isn't very, I would say, in their opinion at least, it wasn't really appropriate for PPI. They're not using it. But as I said, there was still a lot of positively inclination towards it. Okay, so then we'll go on and talk a little bit about the challenges and benefits. So I bucketed these into a couple of different things, and I'll go into these in a little bit more detail, but just to give you a sense of the challenges, I kind of tried to put them in some bullets here. So there was a lot of conversation around payment for PPI contributors, flexibility there, the tax implications, how you're not being able to do that can be a blocker and so on. So we'll talk a little bit more about that in a moment. But the second big kind of bucket came in around time, right? Time considerations, how much time can be involved in it. It's underestimated, and so on. What I term emotional labor, I don't know if that's a great term, but certainly I got the sense from the researchers I spoke to, they were really invested in this work, right? They definitely feel that sense of responsibility, and sometimes that I suppose tips into almost a sense of anxiety, because they really do care about the people that they're working with, and they want to make sure that they're representing the views properly, they're involving them in the right way, and so on. PPI panel considerations, so recruiting people to begin with, retaining those contributors on your panels. Is the panel sufficiently diverse? Is there legitimate representation on that panel? And these were all things that people spoke to me about. The logistics complexity, right? So trying to organize meetings, anyone who's ever organized a wedding or any big event will understand this, right? Just trying to bring people together, the complexity of it. A lot of the people I spoke to, they were doing their research during pandemic lockdowns as well, which also caused quite a lot of logistics complexity. And just the communication and facilitation of meetings and so on, there's plenty of challenges around that. And then on the other side of the page, we talk a little bit about benefits. So a lot of conversation around the outputs, right, of involving contributors in PPI and how that increased the relevance and made it more likely to be successful in terms of publications and in terms of value. I tried to kind of get at this, okay, apart from the research, how do you feel about it, right? What is your kind of personal kind of view of it? And people talk to me about the motivation, how talking to people who have the illness or who have the particular issue or whatever, how that increased their motivation to continue on with the work. They talked about it being a very grounding exercise, right? And realizing how this particular issue or whatever it might be really impacts people on a very personal level, and it increased their empathy and understanding. And then as a byproduct of all the work people are doing in PPI, they have an increased skill set, in terms of leadership, facilitation, advocacy, and communications. Those were some nice kind of benefits that people called out to me. Okay, so I'll just drill in a little bit on some of the challenges here. I mentioned this already, but the big issue here around payments for participants, I think nearly everybody brought this up in some fashion or other, right? And I'll let you read the quotes there yourselves, but I think, I know this is an issue that Adele can speak to a little bit more, right? But it is something that where I think people were getting frustrated was because they felt they couldn't continue with some meetings, some planned meetings and so on, if they couldn't offer the payment to the contributors. And that was a kind of a frustration for folks. And also the point there, the last point there around the tax implications for people who might be on social welfare or government payments or so on. So that came up loud and clear. The other challenge that we spoke about a little bit was around time and adequate time to incorporate PPI. I liked this quote. I know it's a long one, but I felt it was worthy of inclusion. So it's a structured PhD program for 4 years, and PPI was a big part of that, but it was an extra task in an already very full research program. So it's kind of a trend. More skills and more aspects and perspectives are added to the PhD work, but the time is not extended. The pay is not extended. It just keeps moving out without, and then they talk about the support, not That's not to say there wasn't support. There was huge support from a supervisory and training perspective, but the time was challenging. It is worth the time, but it just adds pressure to other parts of what you have to do. So I think a lot of PhD students will recognize that. But on the other side, there was also a recognition that it's not just the researcher with time. There's also time from the contributors as well, right? And again, another quite nice quote there about, I would never query the amount of time or investment that goes into it, because look at what they've done for us. Never, ever. I mean, they have invested a huge amount of time in us. So a good kind of recognition there. So a couple of more on the challenges. I've touched on this already briefly, but PPI work can put an emotional toll on researchers. And I think that's important to recognize. I've condensed a couple of the quotes here, but the nature of PPI work is you're working with people, patients. They might have very difficult, life-limiting health conditions, and it is emotionally difficult work. To get them involved in that, you build relationships with these people, you feel for them, you feel the empathy, and so on. So researchers can find that very hard. The other aspect of it, I think, and this goes back to the kind of, I suppose, bigger research kind of hierarchies and so on. For the researchers who build those relationships, who become, I would call it like an accidental advocate, almost for their PPI contributor group, they are sometimes then the person in the room representing that voice back to the larger research project. And if for whatever reason that doesn't all kind of, I suppose, get taken on board, the researcher feels that they're maybe let the side down in some way. So that is kind of an emotionally challenging space to be in. Logistics definitely can be a challenge. Talking about, so logistics in general can be a challenge, but I think the quote here about talking about people who have, tough lives, right? The nature of some people's lives means they can't be, okay, I'll commit to being here at a certain time and a certain date. So from a researcher point of view, you have to be extremely flexible, right? You have to drop everything and go. Something might be last minute, and there needs to be a recognition of that, from an academic perspective, that is the reality of research in certain areas, and things can't necessarily always be planned in advance. So that flexibility is required both on the part of the researcher and on the part of the university. So I thought that was an interesting one. And then we talk a little bit about PPI contributor panel and selection and representation. And I do think this is something, I know I was at the PPI Ignite, the Network Summer School in UL earlier this year, and I know this was talked about quite a bit, and like it's a really difficult problem. But I struggle with the idea of how people are selected and invited and enabled to participate, and how legitimate that is, I suppose, and how people are excluded for all sorts of reasons from that. There is a tension, I think, between working with the same organizations and the same people over time and building that relationship, which is so important, and building the trust versus always hearing it from the same people and everybody perhaps getting a bit too close and too cozy in the sharing of their views. So I think anyone who's worked in PPI for a while will recognize that sentiment and the kind of conflict in all of that. And from most of the researchers I spoke to, they talked about how they got their contributors on the panel. Some people were able to kind of piggyback existing panels. They were able to advertise and get people that way. But there was, I will say, a general recognition that maybe they don't have it all just right? Maybe there needs to be, the next time they were doing it, are they actually going after those more underserved groups? So there's a recognition there, but nobody says it's easy. Okay. So then to talk a little bit more on the benefits. How am I doing for time? Okay.
Good.
Yeah. Okay, so in terms of benefits, what we talked a little bit about was the increased relevance of the research output and the more likelihood of success. So I captured one quote here, which I thought kind of resonated somewhat, but I will say across all of the people I spoke to, they credited the PPI contributor and the input from the contributors. They said they got better responses to surveys because of it. They got better recruitment and retention for clinical trials. They got better reach in terms of dissemination of results. And, they felt also better publications from having involved PPI contributors. So there's lots of benefits there as well. PPI was a grounding experience. I haven't done a PhD, but anyone I've spoken to who's done a PhD will tell you that it's difficult work. You're very often working away on your own, you know, on a laptop, looking at data, and it can be kind of isolating, right? And you're going through all these research papers. So I thought this quote was really interesting. It said, sometimes you're looking at a research paper and you see data, and you see mortality data, or you see adverse events data, and you just see it as data. But when you bring in those PPI elements, it helps you remember this is affecting people directly. So I thought that was really interesting. PPI can be professionally and personally rewarding. And this is talking about the motivation, right? So after PPI meetings, people have the greatest motivation around the work and the greatest desire to do good work and want to plow on with what they're doing. So it's a motivating factor and feel like a better researcher. Talking about skill sets, right? So I just, from going back through the interviews and so on, these were some of the skill sets that people kind of called out to me and through the threads of conversation. And I think they will resonate with the audience today, right? I won't go through them all there, but the main point I will make about this is, yes, people see the benefit of the skill sets and increasing those skills, but there is also that other, I suppose, I'll call it risk, right? Around the weight of expectation, particularly on people who are early in their careers. And are we asking too much? You know, try and get that into one person may not be possible. Not everybody can get up and do a presentation. Not everybody feels comfortable doing that. So just a recognition that there's a flip side to this, I guess. Okay. So that is the benefits and challenges. So I'll just kind of close out with a few conclusions. So notwithstanding the challenges, there's certainly a lot of goodwill towards PPI, at least from the sample audience I spoke to. So as PPI gathers momentum here, this kind of incremental approach that HRB and others have taken, right? They've taken a kind of a slow, sensible kind of strategy, building it slowly. And there's significant capacity building as well through the work of PPI Ignite Network and others. It builds it slowly, but it's bringing people with you, right? So I think that's really important. Again, I know this is a small sample size, but from what I looked at in the literature review and what we spoke about earlier, you know, there was the word tokenistic came up quite a lot, right? Certainly in the people I spoke to, there was a genuine willingness to share decision making. That tokenistic kind of attitude did not come across at all. So I think that's really, really positive and something that hopefully is, you know, representative of the wider PPI research community. That push to practice PPI by funders, that needs to be backed up by the removal of barriers. So the issue of payments, that one we know is complex, and it certainly compounds the difficulties of reaching out and getting involvement from more marginalized contributors. So that is definitely, you know, an issue that needs further work. And this issue of fair representation, that is a difficult problem. I would say the aspiration is there. So I know I've read the PPI network values, the HRB strategy. You know, the aspiration is absolutely there, but more specific guidance may be needed. So Hannigan, who's a lecturer in UL, spoke about, you know, getting statistical input on panel makeup, that maybe that is required, because how, you know, representation impacts on generalizability, right? So how can you generalize the results unless you've got the proper representation in there? And practical support, that is another point around additional funding, the flexibility we spoke about earlier, and time. That all needs, if you're to reach out to these folks who are maybe a little bit more on the margins, you have to recognize it's not simple and it's going to take more time. I would say from this study, at least, the researchers were changed through their PPI experience in a good way. But it does carry risks, and as we've spoken about earlier, and those found in the literature. And I will conclude by saying that PPI is complex. It's a complex endeavor. There's a lot of invisible work based on values and relationships. It's a lot of things behind the scenes. And it may be unrealistic to expect individuals to have all the skills necessary to carry out good PPI. So perhaps looking at it as a team sport may be the more appropriate way to do it. So that is it. I will conclude. There's my references for anybody who's interested in reading a little bit more, a subset of them. And I'd like to thank my supervisor, Eamon O'Shea, who's provided great guidance, any researchers who participated, and the PPI Ignite Network staff who were really helpful. So thank you, everyone.
Excellent, Anne. So thank you very much for a really genuinely fascinating, interesting, and I suppose uplifting presentation. I think in your sample size of 11, you have captured what I think we in the Ignite office would feel is happening around Ireland, and it's lovely to have some research data, you know, kind of saying this. So I'll immediately invite Carmel Geoghegan to come up and respond to Anne's presentation. Carmel is a PPI contributor. I won't even say with the Primary Care Clinical Trials Network in Galway, which I know is where you started, because Carmel is involved in many ways. So if you'd like to come over here, Carmel, where you can you sit there? Oh, you're going to turn it around, sorry. Okay, forget my instructions.
Hi, everybody. I suppose my first, it wasn't called PPI, was back in 2013, 14, when I was doing a diploma here with Professor Eamon O'Shea in social gerontology. I was caring for my mom, and it was with the All Ireland Institute of Palliative Care. And then I got involved, Adele invited me when they set up Clinical Trials Network in Galway in 2016. So it's just gone on from there. I absolutely love being involved in PPI. It's taken years to get confidence and to speak out. And I suppose now I speak for, so I'm just trying to change some of what you talked about, and the payments thing has been a big issue, but we don't all want monitoring. Of course. And we want training for facilitation skills, writing an abstract. I just wrote one last week for the first time. I know it wasn't great, but it was my first experience of doing it for a conference next year. So we want to be upskilled, but not all of us, but some. And it's building the trust, I think, is the big thing when you get involved. And also the researchers, not everybody is suited for each piece of research. And I think that's what we've learned. And researchers have to be honest, I think, as well up front, and tell people if, and even on a personal level, you have to be able to work and connect. So there's been lots of issues about that. Boundaries, I suppose, good governance, you need in terms of reference. And that's become more and more important as more and more people have got involved. And you're on about hierarchy, but there's hierarchy within a PPI group as well. Yeah. And that's coming more and more to the fore. And if you don't have a strong voice and you haven't experienced, you're left behind, and you actually just drift away. And you can't, you know, that's what I suppose what I got really interested in when I saw that happening. You have to get your confidence, and that's a mega thing. And the thing, every voice is equal. And sometimes I think the researcher needs to be a good facilitator as well, which is maybe not everybody's forte, but a lot of voices at the table mightn't get a chance. And sometimes you have to work maybe with one or two people on their own to bring them out, give them a chance, because there's too many strong voices around. And I've learned all that, and I love facilitating. I'm not very good, but I'm getting there.
Here you
are. Patient organizations you talked about there, and I think you're not getting a true cohort sometimes through the organizations, because they are gatekeepers, and you need to go further than those organizations to look for your PPI, and maybe just going out into communities through newsletters, local radio stations, and you'll get people that maybe aren't involved. Yeah. I was quite surprised at all the research that has been done, because at the moment I'm just looking at from the PPI perspective and talking and asking what our experience has been. And it's on a global scale because I've been lucky to get involved. And COVID was brilliant. One of the good things that we could do Zooms all over the world and get involved in research from different continents. So, and I suppose, yeah, I just love what I do. I love being involved. I love, not all researchers, some of them. It's very much a personal thing and building a relationship.
Huge, yeah.
And building the trust and then trying to explain that we are the bridge between the researcher, the ones now that have got their confidence, and getting the public involved. Because we can go out and speak in our communities and encourage them to get involved. I suppose they're the main things really that I would focus on, is having and being open and transparent. And if you think somebody isn't suitable or the fit isn't right, just say it, spit it out, have it out there.
Absolutely.
That would be my best advice. And it's an absolute privilege working with researchers, and the dissemination, that would be a mega thing. We would like to be involved in dissemination. We do not want to hear from somebody else that the project has been shelved. All those, we want to be there from the beginning, and our voice can change the whole direction of a piece of research. And it's definitely being valued. The HRB, everybody is taking PPI on board, and it's definitely not going to be a ticking box going forward, which is super.
Yeah.
Excellent. Thank you very much, Carmel. It's really interesting to hear your perspective as somebody who has, I suppose, been involved over the course of the development and the growth in the last few years. I will say to those online, after Cormac has responded, we'll open the floor to questions, and if people online want to put their questions into the chat, we can take them from there. So Cormac, over to you now. Yep.
Great. Well, thanks to the PPI network for inviting me to be here, and I really enjoyed listening to the two presentations, or the two kind of pieces of input into it. I'm Cormac Forkan. I am an academic here in the discipline of applied social science, and a researcher here, senior researcher in the Unesco Child and Family Research Centre. So just to say a little bit about that, and kind of linking it up to the nature of kind of what we do. So obviously in both of your experiences, it's often the case that it's more health related and social care related research and so on. Our work over the years here has been around trying to do complete research on child, youth and family services, with the view to try to improve outcomes for young people and families in the community. And I suppose I was saying to Del when she said it to me initially about being involved, is that we would kind of know by different names. We would know PPI as participatory research or contributory, kind of people contributing to the research process. So even though that they're different and they're defined different, it feels very much like that they're very related to each other. So I suppose one of the core things that I thought that might be of use and of relevance for people interested in the PPI kind of way and approach is the idea of avoiding silos and methodological or kind of research silos. And what I mean by that is that it's often the case from our experience over the years is that people will own particular approaches, be it a methodological approach or be it a policy analysis approach or whatever it might be, and they will guard it with their life. They will literally die for that particular approach. And I suppose one of the things that we've learned from our work over the years here is that real progress is made when those silos are brought together, when there's a unified approach to it. So one of the things that I think is important to consider, looking at it from somebody that's just beginning to use the formal approach to PPI through our own work here in the centre with our team, is that idea of how to bring the best out of what we already know around participatory approaches, collective research input and PPI, and all the things in between that would really can help the nature of the development over time. So that's one thing I thought that might be of relevance to the overall discussion. The other thing that I was fascinated with was again, from being a researcher myself over the years and working with teams of researchers, was the idea of being self. We talked about it a lot in our own team recently for another reason, but self-care of the researcher is kind of important because there was a colleague here, I think I told some colleagues this before, but there's a colleague of mine in physics a number of years ago. He was talking about first-year students that come into the university, and he said that the biggest progress he could see in the year was that instead of looking at their shoelaces, they were looking at the tops of their shoes at the end of the first year. That they got that bit more confidence. And I suppose the point is that not everybody is going to be kind of, out there and kind of, I'm who I am and I know exactly everything about themselves. Researchers, by the nature of it, have changed over the years in terms of we've all sorts of, makes and shapes and experience levels and so on. But the point is, researchers, sometimes at a master's level or even the early stages of PhD, can be maybe unsure about their skills and their abilities. So I think, as mentioned in the presentation, I think that piece around self-care and who does that emotional labor piece can take a lot out of you. So my question, I suppose, around the PPI is what safeguards are kind of built in through the training, through the development, and through the supervisor's work. If it is a supervised piece of work, around how does that happen? How does that kind of care happen? Does it burn out our researchers? Then the process is kind of left. Or likewise for the contributors, if the contributors are giving all the time, it can be difficult for them, in terms of that as well. So that was something about the self-care piece of it. And I was very much kind of taken around that piece, Carmel, you were talking about the suitability of researchers, is that not every researcher is the most suitable person to do PPI. They could do more harm than good, because they could be as they might not have the skills that it are needed to do the thing in the first place. So there's a bit of thinking to be done, I think, from that honesty perception, or see then from the researcher side of it. Am I able to do this? Is it something that I have naturally? Can I be trained in it? Can you ever learn these skills? All those sorts of questions. And I really like the idea of the team. Maybe it's a team sport. Maybe it's something that somebody could do the setting up, somebody could do the analysis afterwards, and then somebody else could do the actual piece of the process. So I think some of those things that are important in there. The other piece that kind of strikes me a lot, and it kind of comes back to Carmel's point as well, about being involved in the dissemination and all that piece. For me, as kind of an academic and a researcher, I think there's a tendency sometimes when we come up with something or we're interested in something that it's all about how to do something. So it's all about how to do this particular approach. So these are the steps you must go through and so on. I put it back on everybody to think about it in a broader sense, to think about, well, ask yourself the question, why am I doing the research in the first place? So in other words, instead of just asking how am I going to do it, that you're asking yourself, why am I doing it? Because is it an empowerment piece of research that you're doing? Is it something to do with building empowerment in the group that you're working with, or co-creating that? Is it something about an advocacy piece of work that you're interested in? And I think that kind of focus on moving from the nuts and bolts of how to do something to always be informing your approach by why you're doing it, I think is really important. And something that I've learned, we've all learned here over the years, is that sense of keeping that really focus. Important. Yeah, that you're not stuck in the day-to-day of all the time of kind of why you're trying to do it. Just two other points, and I'll stop talking then, is the other thing that kind of strikes me as well is the longitudinal aspect of it. I didn't see from, I'm not totally familiar with the PPI literature, but from what you mentioned, obviously, the longitudinal kind of study, it's only, as you said, 10 years kind of in the making or so. I think that would be of real value as well, as to track over time, what value does it have for the contributors? What value does it have for policy change, if that's what it's about? What value does it have for the researcher? Because that can tell its own story, that longitudinal piece that's done in other disciplines and has been done in other disciplines for centuries, about trying to track people over time and see what impact does it have for all sorts of reasons. So that's something that I think that could be kind of considered. And my last point is it's something about the institutional piece, and what you kind of mentioned it, you mentioned it particularly in yours around the institutional difficulties. So you have the HRB or equivalent agencies offering funding based on PPI kind of approach, but then you have all the institutional rigmarole we've dealt with here around literally how do you get money out to people that can't afford to go from A to B until after they go is the only thing you can get the money. So I suppose the question I pose around that is, you know, PPI by its very nature is looking out. It's an outward looking approach. You're looking out towards a problem, towards an issue, involving people in it. But there's an awful lot of stuff that we need to do as a collective group around values. Because if we really value this as an approach, we will go through the channels to change the institutions that they are more PPI friendly. Because I'm sure it's the same in other institutions. Our sector is not the most friendly to deal with when it comes to all of the issues that you mentioned. So I think that's a major piece. Instead of looking out, we need to look in, fix our own house as well, our houses, so that we can actually do this effectively, because it does put pressure on the researcher and on the individuals. Oh, totally, if you can do that. And the removal of the barriers, as you kind of mentioned. So it's kind of a two-way street. If we tell the funders as a collective, well, we can't do this, because the funders will soon talk to the institutions and the powers that be to say, well, look, we want to do this, but we can't. So that's kind of it. I think that's what I took on.
Yeah, excellent, Cormac. Again, thank you so much. And it's really interesting to hear your response, given in particular the work you have been doing in this space, in the UNESCO Child and Family, and over your career. So I think we'll might end our recording there, and we'll open up the floor for questions. And while we're just waiting for some questions to come in,